get better. And people often have to change their whole attitudes towards how they're living their life and what they think is important and what creates anxiety and what they find important. And you know, slowly in the process that happens, people want to live a different life. And I'm not talking a different handicapped life, I mean a different life, the way they stand and what creates stress in their life. You know, and it's a process, but of course, when people come the first time, you zip about that, because many people come and they've been told it's all in their head. And so when you start talking that, you know, maybe what they're doing and how they're thinking, then, you know, you just go down the same road, and that's not what you want to do. You know, what often happens that when the the physiology is affected by infections and adrenal fatigue and all, and foods you eat and gut imbalances, then you just can't deal with things emotionally and the things that happen in your life. So it's very difficult. So there's a few of the statements I hear a lot. Well, my experience is that people who are not ill can't really imagine what a sick person feels. Mm-hmm. You know, people, you look good, but I'm tired sometimes.
Yeah.
Why don't you pull yourself together? You know, things like that. And they're just like, you know, when a person can barely get out of bed. You know, my wife had Lyme for 6.5 years before we figured out that's what she had. She got sick a week after our daughter was born. And she got neck pain and fatigue, and, you know, but she didn't have enough milk. And of course we had an infant in the house, and I didn't think much of it, but months and months passed and it didn't get better. And I was doing already integrative medicine. Minus ever heard of Lyme. And so I did adrenal and foods and many of the things I do still do. And it would help a little bit, but over time she got more and more pain and more exhausted. And by the time, and that was one of the reasons why we moved back from California to Pennsylvania, she's originally from Pennsylvania, to be closer to her family. And I started my practice here, and I found that people weren't getting as better as they were in California when I did my usual testing and worked with diet and the gut and the hormones, whatever I did. And that's when I heard the first time about Lyme disease, and I started checking it and found it left and right. You know, she would be, you know, laying on the couch, you know, because there were days she couldn't get off the couch. And she describes the scene. She said, I'm laying on the couch, there's a cup of coffee on the coffee table, and you're looking at it and you wonder whether dragging yourself up is worth it. And you decide it isn't. You know, when I tell that story, people say, yes, that's what I have. You know, but you look at the person and they look good. It's really very difficult. The exhaustion and the achiness and the funny symptoms that create anxiety is really quite intense, can be. And so, you know, the irony was that, you know, my wife turned out to have Lyme disease, and we found the DNA of Lyme in her blood. And it took her a number of years to get better. I mean, I wasn't into it, I just got into it at that time. So lack of sleep. There's a lot of sleep disturbances with Lyme. Either hypersomnia, people are sleeping all the time, and people, you know, they wake up or they can't fall asleep, or the sleep is not restorative, and that really piles up. Very important. Structure is what chiropractors and other people work with. You see a lot of joint structural imbalances. I remember my wife saw a chiropractor all the time, and then it would help, but then 2 days later she was out again. And these things are very useful. There are all kind of techniques that various practitioners use, can be very useful. You know, so that's an important thing. Structure imbalance is there, you know, and things that play a role too is, you know, that people sometimes have concussions from the past, injuries. Sometimes Lyme goes where you had injuries before. And, you know, when you then have Lyme and you get brain fog, but you had also 1 or 2 concussions in the past. So all of that already affected the brain, and then these infections make it worse. Yeah? Digestive imbalances. You know, almost everybody who's chronically ill has imbalances in the digestive tract. 70% of our immune function takes place. yeast overgrowths, food sensitivities, bacterial imbalances, and we're learning more and more how what we call the microbiome, which is the totality of bacteria we have in our body that assists our immune system and imbalances in that, have an enormous effect on our immune system. And of course, it's a double-edged sword. When you treat people with antibiotics, that you can mess it up more. And so you always have to do things at the same time to prevent that. Sometimes I have people with, they come in with Lyme and then they've had chronic diarrhea and bowel problems, and I think, wow, if I'm going to give them an antibiotic, it's going to get worse. And you give an antibiotic and everything gets better. And that's where Lyme can affect actually the digestive tract. And they found the DNA of Lyme in the bowel of biopsies of the digestive tract. So that says a little bit what that. And then the last one is hormonal imbalances. Almost all people with chronic illness have weak adrenal glands. I do a lot of saliva testing for cortisol, and many people have weak adrenal glands, and it causes fatigue and low blood sugar, and lights bother you, and you get irritable, and you feel you don't get enough oxygen, even though you're breathing normal. There's all these, and you get more tired as the day goes on. There's all these symptoms that are very typical adrenal. I see often people that were treated for Lyme disease in the past, and then they come in and they say, I think my Lyme is back, and I listen to them, and I say, I think it's just your adrenal. Your body is exhausted. And then we work with the adrenals, and sometimes within 2-3 weeks, they improve dramatically. And so when I do testing on people, and they're very sick, and they have all these symptoms, and I find even a positive Lyme test, and then there's really these adrenal and other hormonal imbalances, and I say, well, let's do this first. And when I treat them for that first, and they get 50% better in 2 or 3 weeks, I say, just forget about the Lyme. I don't think it's that big of an issue. And then you keep working with it, and then you might go back to that, but often you don't have to. Thyroid, subtle thyroid imbalances. And again, in conventional medicine, there's a very black and white, the adrenals are only wrong when they're broken, when you have Addison's disease, or you're on the edge of Addison's disease. When the TSH is within the range, then your thyroid is normal. And I treat a lot of people with very small amounts of thyroid and sometimes hydrocortisone, and of course other natural and herbal substances, and that can make a huge difference. So what do you do all about that? This might sound all very complex, and you listen to that, it's like, where do you start? What are you going to do? And again, there's an individuality to that. So first, you need to figure out what's the matter. And I find in my experience, William Osler, anybody heard of William Osler? He's considered the father of modern American medicine. He died in 1919. He was one of the founders of Johns Hopkins. And William Osler said, 90% of diagnosis is made with history alone. And I think that's still true. However, we have more fancy tests available that can confirm and give us more details. But when you listen, you can hear and interpret many of these symptoms. The problem is in the way we practice medicine, and as physicians, that young physicians are educated and trained, much is focused on objective tests, blood tests, x-rays, that's what we do. And there's no time to listen to symptoms and even have the opportunity to develop experience in interpreting these things. Does that make sense? So what I find is often when people come to me and they fill out a 20-page questionnaire, and I look through that, often I know already what I'm going to find. And then I go do the testing, and then I ask details about these symptoms, and many times people say, I say, you have an anemia. I say, do you have that? Oh, yes. Do you have this? Yes. Do you have that? Yes. And they say, well, how does he know I have all of that? And I describe how it feels just because I've heard it so much, but then it confirms that there's something the matter and that there's an idea of what that could be caused by. So listening is very important, and you know, and when you look at it in an integrative way, see, a regular physician doesn't want to listen to all your symptoms, because when you have to deal with all these symptoms, you can't do it with that method. You get very confused, and you have to kind of say, stop. You have to make another appointment for that. But when you deal with it in an integrative way, I don't care whether people have 10, 15, or 30 symptoms, because in the end, we're trying to bring it all together. Yeah? And the solution is not doing 30 different things. It would be 30 different things if you only do symptom relief, and a lot of our treatments, especially in these functional disorders, is based on symptom relief. You know, for fibromyalgia, you get Lyrica and anti-inflammatory and amitriptyline and whatever. These are just symptom relief. They don't deal with an underlying cause. So testing confirms the diagnosis and gives us the details. So usually what I do, I have a kind of a way, depending on your history testing, I do testing for tick-borne illness. I use mostly a lab in California called IGeneX. I think they have more accurate results, and they pick up things other labs don't pick up. Now in the last since July last year, I've been using another test where, I used to do an early on DNA testing. You draw blood and you look for the DNA of the Lyme bacteria or other bacteria, like they check for hepatitis C. You can do viral titers for hepatitis C, you can do a DNA testing, you can do DNA testing for HPV, which they do on pap smears, and when you have that positive, nobody doubts you have the illness. But often when you do DNA testing for Lyme and you have it positive and people go to the infectious disease specialist, the doctor says, well, that's not a standard test. It's really strange. But the problem is with this DNA testing out of the blood, it's kind of a crapshoot. You could do one, another, and they're all negative, and suddenly one might be positive. Well, people can't afford that. They get discouraged. They say, well, I'm negative. So there is a lab that in Colorado that does DNA testing of a number of tests in the urine. And so what I have to do is I have people go have a deep tissue massage for an hour. So they get really into these muscles where it's hurting, and then we collect the first urine. And I would say about 70% of these tests that I've done, they show even things that don't show up on antibody tests. The Babesia shows up, Bartonella, Lyme, which is really quite, just the other day I got a young woman who I did the antibody testing, and only Babesia showed up a little bit in an antibody, but I got the urine test, and Lyme and Babesia and Bartonella showed up in the DNA. So there's ongoing improvements in this kind of testing. The problem is with, often that testing is not covered by insurance. That's always a problem.
How much is a Colorado test?
It's $500.
Too bad.
Yeah. You have to wait 4 or 5 weeks. And then when you pay them extra, they do it quicker. And I talk to them at the Lyme conference and say, that is really not fun. The people come in and they're waiting, they're wondering. He said, but we're so overwhelmed, we have to do something if somebody wants to do it fast. And so they charge more money. So I do food sensitivity testing a lot in blood tests. I do cortisol saliva testing almost on everybody. I test for toxic metals if that's indicated, especially when you have older people that have been exposed to things, or people that professionally have been exposed to heavy metals. And then I do a whole bunch of testing with LabCorp and Quest, vitamin D, some infections, yeast antibodies, more detailed thyroid testing, pregnenolone, so a whole variety of tests. And then sometimes I do stool testing to check if there are bacterial yeast imbalances in the gut. And then it just depends. So all that is kind of more determined on your history, what people have been, what tests they've had, so that you don't want to keep repeating tests. There's recently a lot of talk about mutations that play a role with detoxification called MTHFR, organic acid testing, neurotransmitter testing. We do a lot of, we do neurofeedback in the office, sometimes we do brain mapping. They're very typical patterns. We see people with what we call Lyme brain. Because we see even when people, once they're better with a lot of their physical symptoms, often, I said, my brain is just ain't what it is. I can't remember things, I can't multitask, and we see when we do brain mapping and we measure the electrical activity, it really looks a lot like ADD. The slow waves are sky high and the beta waves are low, depending on what the situation is. And you can actually, with neurofeedback, you know, make that brain work better. And it's very, very interesting. I'll talk about it a little later. You know, testing that many people have had, like SPECT scanning, MRIs of the brain, lumbar punctures, nerve, I found them to be absolutely not useful. You know, mostly when people get these tests, the neurologist or the doctor knows already. But you're pushy. Something is wrong in your head and you want an MRI. You know, it's kind of, you're programmed that way. You know, something is wrong and nobody's telling me what. I want an MRI, and then you get an MRI, and all these normal MRIs. It's really quite, and you're on lumbar puncture. You have neurological symptoms, and the neurologist says, well, let's do a lumbar puncture, and if it's negative, you don't have Lyme in the brain. Well, that is completely worthless, I find it.
Is that a spinal tap?
Yes, that's right.
Okay.
Yeah. So, you know, how can you try to kill bugs? I mean, yes, there are antibiotics, and I do use antibiotics. There's a whole bunch of them that treat various, you know, doxycycline, minocycline, ceftin, azithromycin, clarithromycin. They all help with Lyme. Some of them, others, they cover, like azithromycin, it helps also with Bartonella, and Babesia. There's Bactrim that helps a lot with Bartonella, rifampin, that often is used in addition. Mepron, which is an anti-malarial drug that I use for Babesia together with others. Plaquenil, which is actually hydrochloroquine. Many people come in and they've been diagnosed with autoimmune disease and they are already on Plaquenil. Because they, in rheumatology, they use Plaquenil or hydrochloroquine as a lupus or rheumatoid arthritis drug. And levaquin. So there's a whole bunch of antibiotics, and it's kind of a, you know, when you, a hodgepodge, the way you work with it. When you look at, you know, I was at the Lyme conference of ILATS in November here in Philadelphia, and, you know, nobody really treats anybody the same. It's such an individual thing, and there's, you know, it takes such a long time to get experience in working with these things, and you can't get that with everything. It's just impossible. And there's probably many ways to help people get better. So there's, you know, antiparasitics that I use, Flagyl, Tindamax. I don't use them that much. I found them to be not that useful and makes people sick. And then there's a whole bunch of herbal protocols. You know, the Cowden protocol, the Buna protocol, there are books out there. And, you know, there's some fire and white formulas. I started recently working with some herbs. They're from a company called Monastery of Herbs. Sounds really nice, but they have all these fancy, pretty intense herbal protocols. And you know, I have never used herbal protocols by itself. Patients do it. They say, do I? I say, okay, if you want to try, let me know. And I've had many people that are on this 5-6 months, and you know, people get better from various things. So I can't say yes or no, but I am not really in detail experienced in using them. You know, there are people who do homeopathic protocols. Colloidal silver has been used. So there's all kind of things that are focused on trying to kill bugs. You know, diet. You know, that's, to me, just a fact. If you don't change the way you eat, unless you're already eating well, it's very difficult to get better. You know, all sugars, refined foods, try to eat from scratch. Try to eat organic when you can. Stay away from GMOs. Just to eat healthy, you know. And I know that's not easy when you're chronically ill because you're tired. You know, my wife is my father-in-law is ill, and she's been up there taking care of him, and I'm eating frozen Indian foods, and I go to Be Good. It's very difficult. You're busy, and it's very hard to eat well. You know, it's. I get it. But you know, we try to help and come up with ideas that are practical. You know, make it simple. You know, there's various diets people work with. The very popular right now for chronic Lyme is the paleo type diet, where you really cut almost all carbs out. We've had some good results with actually low-fat plant-based diets, which are 80% carbs, but they're whole foods. They reduce inflammation, and so there's various diets, and we work with people in a different way. You know, we establish food sensitivities, and then we just work with, you know, eating a clean diet. There's a guy, what's his name? Michael Pollan. He's a food writer. He wrote books, and he asked this, you know, you know, what is a good diet? And he said, eat whole foods, mostly plants, not too much. Those are the three big rules. You know, so when you do that, you know, you can say whether somebody is vegan or vegetarian or they're eating paleo. It's all, you know, we have to just work with it. At one point, I tried to focus really much on encouraging people to eat whole food, plant-based diets, and we spend a lot of time and effort. And people are just, there are very few people who are interested in doing that. So we do it mostly. Angela eats that way. Marianne eats that way. I eat probably 80% that way, and 90 depends a little bit. When my wife is home, I do it more than when she isn't. But they're very good diets, but most people are not interested in doing that. It's a lifestyle. Of course, food sensitivity, that's a little about pesticides in the food. The film was that. Food sensitivities, you know, I do a blood test, measure 115 foods, anywhere between 10 and 30 show up. I say cut them all out for 3 weeks. If you feel better, eat them again and we'll see what happens. And then you figure out which foods they are, and it can be a huge thing. Very common, wheat, yeast, dairy, eggs. Food show up, and then people cut them out, and suddenly their achiness gets better, their brain fog improves, their bowel improves, a lot of it just from these food sensitivities. These are not the kind of sensitivities or allergies you get from a skin test. They're delayed type of food sensitivities. You know, and unfortunately, one lab is not like the other. You know, there's all various labs do that, and the results can vary greatly, and that's why conventional allergists, I think, don't really put much stock in them, because you know, they may not have good results, because you know, one lab is not like the other. Yeah.
I have a question on that. I had done one with you long ago. I was looking back on my record, and there's a number next to my food sensitivity. Is that a scale 1 to 10?
1 to 4.
1 to 4, 4 being the worst?
Yes.
Okay.
Yeah. But you know, sometimes a 1 is bad. Like I had a 1 for wheat, and if I eat wheat, I ache and I snore. Do I never eat wheat? I eat wheat sometimes, but I don't. If I eat wheat every day, I don't feel good. I feel old. You know, that's what.
Yeah.
Then, you know, detox, you know, heavy metals. I use some herbal and prescription detox. So we have an ozone sauna here in that room. If you care to see it, it's kind of a fancy thing. You sit in with your head sticking out, and it's an infrared, and your whole skin gets exposed to ozone, and there's some microcurrent therapy. It's almost like a spa-like experience that can help with detox. I love for people to do a rebound. However sick you are, unless you have severe joint aches, I do this most mornings. I get up, and the first thing I do, I move my joints through. It takes me a few minutes, and I go on the little rebounder. They cost $100, and I just jump.
2 feet together, or like a run?
No, I just jump like that 100 times,
Right.
like that.
So you're not trying to run on it. You're just.
No, I
just
do you know, it wakes me up. It
Yeah.
stimulates the lymph system, and it's something I can commit to.
Yeah.
Does that make sense? I'm not an exerciser. People always say, oh, you must exercise. I don't like exercise. So I have to do something I can commit to, and I can't have an excuse to do. So I basically jump 400 times. And that takes a few minutes. You know, you do 1, 2, two jumps a second. And many patients that I have, they get one of those, they don't take it up a space up. You don't need the one with the handle, you know, you can have it next, you can put it against the wall. And they're amazing for just getting the lymph flow. Because many people that when they're chronically ill, Yeah? How many of you have that? You go to bed and you wake up and you're all groggy. Yeah? You don't feel rested, and it's often because when you're sick, your lymphatic system doesn't work well. And during the day, you have at least gravity help you. But when you lay down, you take gravity away, you get this congestion, and actually your brain's lymphatic system works at night. That's when the lymph, and when you can't do that, you wake up all groggy.